Just want to thank everybody for the very positive response I got on the last video that I did, and they said keep them coming, so we're going to keep them coming. So today I'm going to talk a little bit about what I know from the last time. A lot of it I still don't know, but there are a few more details that have come through. I've spent a lot of time in the last month or so watching webinars, going to websites, listening, reading news, everything like that. So hopefully I can condense this to make this very simple for you. So let's talk about what's happened since the last time that we spoke. A lot of the rules we still don't know the details on, but here's a couple of things, and I think some of you may have already received an email from me about early renewing. The carriers are going to allow several of the groups that have already renewed to early renew as of 12/1 in order to keep out of healthcare reform and also to keep your costs down. We're seeing renewals for December 1 possibly being 9 to 10 to 11%. If they wait and go into healthcare reform, we're looking at anywhere between 35 to 65% rate increases. So we have sent most of you all a letter that asks you to sign to do an early renewal. Now keep in mind, when we do this early renewal, even though the carrier says if they give it to you, you have to live with it, that doesn't mean that I'm not going to shop it anyway. So we'll send it out to the other carriers. We'll be looking at the SHOP or the small employer exchange that the Department of Insurance has put into place just to see which way is the best way for you. But I feel like that you at least need to have the information to make the decision of whether you want to go into healthcare reform or put it off as long as you possibly can. For most of you, it's going to definitely be a savings to do a 12/1 renewal to put us off for a year. This also takes away a lot of the confusion with the startup of this, gets us out of all of this, gives us time to strategize, and who knows, maybe somebody will get some common sense and this thing will be modified in some respects. But I feel like for most of you, it's going to be better if we early renew for a 12/1. If you've not received an email from me and you're interested in discussing that, some of you may be with Anthem right now. We have still not gotten anything from Anthem as far as pricing of whether it's better that you stay in the exchange or go out of the exchange. So I'm kind of waiting on information on that. However, you probably will be receiving an email from me in the next couple of weeks, those of you that are with Anthem. We're at least going to shop it with Humana because Humana right now is pretty much taking all their underwriting away. They're only looking at about 24 conditions, and if your group doesn't have those 24 conditions, you could save a tremendous amount of money. It doesn't hurt to look, we just don't have to accept it. So really what I'm trying to do right now is figure out what is the best avenue for you as an employer to be able to save money, possibly stay out of healthcare reform for a year, and let's give it time to work itself out. So let's talk about what your options are going to be as a small employer. As a small employer, which is 50 and below, you're going to be able either to early renew 12/1, or we can move you to another carrier 12/1 from the one you're currently with, or we may look at the exchange and say, just let's go into the exchange in 2014 when you actually renew. But at least you'll have those options in front of you and you will be able to make a decision without just waiting until you renew in 2014. And that really wasn't a good idea, and it's going to cost you a lot more money. We'll also have to look at your employee population. We'll have to decide if possibly maybe it's better that you give everybody money and they go into the individual exchange because of the subsidy arena. And we can talk a little bit more about that. But employees, if they're offered an employer plan, and then they decide they want to go into the exchange, they can do that and they can leave your group insurance. However, they will not be eligible for any subsidy, nor will their dependents as well. However, for the dependents, it may be better that we put them into the exchange and you just keep employee coverage. It will simply come down to a matter of cost and benefits, and we can also work with your dependents on that avenue as well. So just because you have dependent coverage right now with the employer doesn't mean you have to keep it. We could just possibly move them to the exchange. And again, we'll just have to take that on a case-by-case basis and take a look at it. Now, keep in mind, if you pay 50% of the premium, you will get a tax credit of up to 50% for the first 2 years when healthcare reform comes into existence. So this may be a very good tool for recruiting, for retention, and also to save some money for you. On the small business arena, I want to make you all aware. I've got people that I only know that they have one business. Keep in mind that the IRS and part of healthcare reform is they're going to apply the controlled group rules. That's like for profit sharing plans. They're now going to apply them to the medical plan, which means that if you own 2 or 3 or 4 businesses, because you have ownership in those businesses, we will have to include them as part of your group to decide if you are 50 or over. So we have to be very careful of that. So if any of you own other businesses, you need to contact me as soon as possible so that I can find out if you are subject to that controlled group situation. So I know a lot of you may have little businesses on the side, but if we get them added up and they're over 50, you're in the player pay rule. Also, some of you may have seasonal employees. If you're getting close to the 50 mark and you do have part-time people, seasonal people, we need to talk about how that formula is going to work for you. I'm not going to talk about the formula right now because I don't want to take up a lot of time on the video with something that is totally boring everybody to death and it doesn't mean anything to them. So if any of you are hovering on 50 and you do own other businesses, then we need to talk and you need to contact me. I'll also bring that subject up when I meet with you about your renewal. So basically the 3 ways we're going to be dealing with this is we possibly may go into the individual exchange, we may go into the public exchange under what they call the shop, which is for small employers, or we may still stay in the private exchange, which is all the carriers that we have been dealing with. So not a lot's going to change. A lot of the carriers, the feeling that I'm getting is that it's, as far as plan designs go, it's not going to be as bad as we thought it was going to be as far as having to have a $2,000 deductible and the price going way out of range. The government has ruled that we're going to deal on actuarial values as opposed to deductibles. So if you have a $4,000 deductible, actuarially that may meet the formula. But the carriers are dealing with that, and when I know what those plans are going to look like, I'll let you know. Right now, I think all the carriers have submitted their rates. We're just waiting for the Department of Insurance and the exchange to bless them. So hopefully we'll know more probably about the middle or end of July as far as what plan designs and what carriers are going to exist. I do know that the carriers in the individual market, all the carriers are going to participate in that. We have not heard what's going to happen with the shop or the small group. Small employer group exchange. So we're waiting for that. The 50 plus people will just keep on going like they've always gone. We'll renew them. We'll look at the player pay, whether I have to pay a penalty, whether I don't. All of those kinds of things. We'll deal with those on a case-to-case basis, and you will continue on your normal renewal. That will not change for you all. So if you have any questions at all, seem still confused, concerned, please don't hesitate to pick up the phone and call me and we'll work through this. Again, we're all in this together. I'm staying on top of it as much as I can. I'm actually going to Atlanta this weekend to the National Association of Health Underwriters Convention, where there'll probably be a lot more revealed there. So I will be in touch with you. If you have any questions in the meantime and you don't understand something and you'd like a little more clarification on something, please don't hesitate to contact me either by email or give me a phone call. And again, we'll get through all this together, and as you will find out, you've got me, babe. Thanks.